Alright, I'm gonna perform a practice IV push on patient Millie Larson. I would first walk into the patient's room, ask her to verify her name and date of birth. I would ask any allergies. I would scan her wristband. Then I would go to pull the medication, check it against the MAR, and that would be my first check. And then I would go to patient's room. I would check the medication again against her um, wristband and orders, the EMAR, just to make sure again that I have the right medicine. Then the third check would be right before I gave the medicine at the bedside, making sure that I have the correct medicine before I gave it to her. So I would wash my hands. Alright, with the hand sanitizer. Alright, I would put my gloves on. Alright, so I've done my 3 checks. I have my IV right here. I would make sure it's unclamped. I would first clean the IV with alcohol. Have my normal saline. The order was for 3 mLs prior to make sure that the line is patent. Alright, so I get my first 3 mLs. Alright, and then I have my IV Lasix 20 milligrams. IV push, we would be doing it over 2 minutes. And it's 3 mLs. Alright, so I would just push just a little bit, and then I would start looking at my clock. So it's 9:40, and I pushed about 1 ml, a half an ml. I'm just watching my clock. So it's been 2 minutes that I injected the 20 milligrams of IV into the fluid. Then I would remove the Lasix and then take the normal saline. And then I would just inject 3 more mLs to clear the line. Alright, then I injected my 3 mLs to make sure the line was cleared of any medicine. So then I would go to my MAR. I would document the medication I gave, how fast I gave it, and that the IV site was, it was without redness. It was, warm to touch. It wasn't cool to touch. It, that it hadn't had any infiltration. And then I would make sure that the line was clamped and the patient was comfortable and their vital signs were fine. And that's how I would do the IV push.